Anterior cervical discectomy with fusion or artificial disc replacement is a procedure that is done for a cervical herniated disc that is typically compressing the nerve roots or spinal cord.
Cervical disc herniations occur in the neck. There are 7 cervical vertebrae, and the middle and lower part of the cervical spine is particularly prone to these disc herniations, most likely related to the movement of the neck.
Back in April, it seemed to be definitely an incident that caused me to have pain that was shooting down my left shoulder blade in the back. It was a very intense pain that I was having, and at that time I tried many other avenues to alleviate the pain, none of which worked.
Herniated discs in the neck present with a variety of symptoms, including neck pain, pain along the shoulder blade, and often pain that goes into the arm all the way down to the hand and the fingers. There is also often numbness or tingling that occurs with the herniated discs in the neck. And often on examination, we find that people can lose motor function or lose hand function related to these herniated discs.
My pain was very, very intense. It usually was between a 7 and a 9, to the point where I couldn't concentrate. I'm a teacher, and it was affecting my ability to concentrate at work. I was limited in mobility tremendously with my left arm. So I would say it was quite significant. There were a number of possible treatments that I could have tried, but it was definitely recommended by the doctor at that time that surgery was the best way for me to handle the situation, and it would alleviate the pain right away.
Typically, the surgery is performed through the front of the neck where the spine is exposed and the disc is removed, relieving any pressure on the spinal cord or the nerves. In place of the disc, either a piece of bone graft for fusion or other material or an artificial disc can be used to replace the previous existing disc. For a fusion, a small plate and screws can be placed, which typically do not cause any problems with airport screening.
The day of surgery, the surgery took place at St. Charles Hospital, and the staff there greeted me in the morning. The procedure before surgery was pretty painless. You know, a few doctors came in and evaluated me. Everybody was explained everything well. It was a very comfortable experience. Surgery was on time. My visitors that were there were kept in touch, you know, what was happening, and you know, they were communicated, the results were communicated to them timely. I woke up and I was pretty much pain-free shortly thereafter.
Most of the patients after the surgery do not have significant pain because there is no significant muscle dissection in the surgery. They usually go home in 24 hours or less. They're able to drive in approximately a week to 10 days. And they're able to return to work in sedentary type of jobs within 2 to 4 weeks.
I was one night in the hospital, and I was discharged the following day after the surgery. Within days, I was able to do most of the things I needed to take care of myself, and I was able to return to work just a few weeks after surgery. Everything about my experience with this whole process was wonderful. I remember complimenting the doctor at some point along the way, saying, you know, it was a stressful thing to go through, yet everything about it, from the day I was diagnosed to post-operative, was very comfortable. My post-operative experience has been perfect. There isn't any symptoms of anything. The area where the surgery was has healed very well. There's very little scarring. Most people looking wouldn't even be able to tell that I had any surgery. My experience has been excellent. Absolutely, I would recommend the procedure and this practice, absolutely, and I have.